Joining us this morning, as I promised, is Chuck Hanson from Anchor Insurance. How you doing, Chuck?
Good, good. I had a little problem this morning. I got into a heck of a traffic jam. I was like third in line at McDonald's drive-thru.
No.
Yes.
Oh,
so
boy.
Kind of made me run a little late here.
That's understandable. The cold bothering you at all?
Yeah, I've been fortunate that no pipes have broken or anything like that, but boy, I'll tell you, I just can't seem to get warm. You'd think with all my extra padding, I'd be plenty warm, but boy, oh boy, I'll tell you, it just.
I'll tell you what I've been doing, and I'm not sure. I have to ask Jim Tully because he would know this. I've been running my water with a slight drizzle to try to keep those pipes from breaking, and I'm scared to death of that. You know, that could be a major financial.
Yeah, but
burden.
you've got a fairly new home, so I mean that's.
Yeah, it's what, 4 years old.
Yeah, you shouldn't have to worry about that. I wouldn't think.
Hoping not. Hoping not. And yours is new too, though.
Yeah.
You know.
But they said this is what 30, 40 years since we've had this colder weather for this long a period of time.
Yeah. It's taking its toll, and I'm like you. I mean, I'm not a light person, but it just seems to chill you to the bone. And they do say when you get older, you do feel that more than you would when you were a kid. But
well, what really hurts is that wind. If it's
yesterday,
like you said, it's really bitter.
It was bitter. Hey, you know, you emailed me and said you had a interesting subject matter today, and I really think it is Obamacare. And I'm going to turn it over to you, let you take over, and maybe you'll get some phone calls. I have some questions about it as well.
Well, the good news is that the system's actually getting better. Excuse me. More people are able to get online to get signed up for it. We actually have a website that is dedicated to Obamacare, in which that our customers, or any customer actually, can go online, shop for policies, learn about the different provisions of Obamacare as best we know it right now. And I think I mentioned before, excuse me, it's an ongoing process. It's evolving. There's changes constantly. Even though the website is getting better, there's still a lot of glitches in it. I mean, it's not perfect yet, but it's much, much better than it was back in October.
It was a mess.
They really brought it out too early. They should have postponed that for a while. And even the insurance companies, they're constantly changing things, different procedures, how to handle things.
How does that affect you?
Well, I've chosen to get certified to be able to sell the products that come under the Obamacare umbrella, so to speak. So, number one, I can help customers, advise them, and actually help them participate and sign up for Obamacare. But again, even being certified, and even the insurance companies that I represent, it's all a learning experience, and it's going to be a learning experience for a while. I got a big chuckle out of something that happened the other day. I was told that every year from October 15th to December 7th, you have an annual enrollment period for Medicare. People that are in regular Medicare can opt out to go into a Medicare Advantage policy and vice versa. You can make changes. They were going to set up Obamacare for those same time frames, October 15th to December 7th. Just recently, Congress changed that to November 15th because it's 1 week after the election.
Figure it out.
So, it just goes to show you how much politics influences everything in this country.
Yeah, unfortunately, yeah.
But the system is getting better. There's going to be a lot of people who are going to benefit from Obamacare. There's going to be a lot of people that are going to pay for Obamacare. In my office, we have a group health policy, and my rates are going to go up close to $500 a month because of Obamacare.
A month?
Yeah, amongst all the employees. Because of all the fees and the components that are built into it, to basically everybody's going to be paying for people that either don't have insurance or people that maybe get subsidies. There's a lot of subsidies being given out, both on the monthly premium and also on the cost sharing benefits, the deductibles and stuff. And
Right.
there's some people that will have lower deductibles because of being eligible for these subsidies. So
What about the thing about in some cases you cannot maintain, some folks can't maintain their regular insurance, they have to go to another plan?
well, the part of Obamacare was that all health policies have to provide certain minimum essential health benefits, EHBs. The government loves acronyms, you know. So you have to include essential health benefits. And if the plan you're on does not provide those essential health benefits, you have to get out of that plan and get into an Obamacare plan. And that's what's happening. There are some policies.
How's it affecting you? Is there people coming in and having to do that?
I'm getting some of that, yes.
Yeah.
Of course, Connie, we have a very high percentage of retired people, which is not really directly affected by Obamacare. So it's more prevalent in areas where you'd have the under 65 population
Right.
that either doesn't have insurance or is losing it through their work, but not quite as much in Connie.
I had this, I was at a dinner party here recently, within the last 2 weeks, and this was thrown at me, and I didn't know what to say, because there was a point made. Why should the people that have kept up their health insurance all these years, paid for it, now be penalized to help those that cannot have it? In this one instance, this couple were going to have to pay $4,000 a year more because of the restrictions and all the regulations that go on with this. And they were pretty upset about the situation.
Well, that's an excellent philosophical question. There are groups of people in our country that think, well, if you can't make it on your own, then too bad. And there's other groups that say, no, we've got to take care of everybody. And there's a lot of thought that falls in the middle of those.
Right.
But there's a lot of things in this country that we do where we pay for others. And even without Obamacare, somewhat of what you were paying went to pay for people that didn't have insurance, because very few hospitals or doctors are allowed to not treat people, to refuse treatment. So they have ongoing costs to take care of those people, and in turn they pass those costs on to people that have insurance through the insurance industry. And you've heard the wives' tales about getting an itemized bill from a hospital and they charge you $5 for an aspirin and so on. And a lot of that is cost sharing for people that can't afford it. Now, one of the problems I've had with Obamacare is that a lot of people who don't have health insurance did it by choice. There are some that couldn't get it because of pre-existing conditions or they couldn't afford it, but particularly the young, healthy people, the invincibles as we call them, a lot of them said, hey, I'm 20, 22, 25 years old, I'm healthy as a horse, I don't need to buy health insurance. So they didn't. And the way any insurance works, it works on the principle of large numbers, that if the only people buy fire insurance are the ones whose house is burning, the premiums are going to be awful high. And if the only people that buy flood insurance are the people that live right next to the river, then the premiums are going to be ungodly high. So what they try to do is they try to spread the cost out amongst everybody so that it's affordable for everybody.
Right.
And that's part of what's going on with Obamacare, and there's going to be so-called winners and losers. The couple that you're referring to, and my own personal health policy through the group plan, yeah, we're going to pay more than we were before, even though we were paying somewhat for people that didn't have insurance then, but we're going to be paying a whole lot more now. So we might be some of the so-called losers. The winners would be the people that could not buy insurance because of pre-existing conditions, or because literally they just couldn't afford it. They were maybe had low income, and now those people will be able to get some coverage. So I think it's one of those things, Pat, that it's sort of like looking at a president. You really can't tell what kind of a president that person was until they've been out of office for some length of time. And I don't think we're going to be able to pass judgment totally on Obamacare until it's been in place for a while and we see how this all plays out. There are still problems. I mean, there's going to be a huge influx of people seeking health care because they now have benefits, and we don't have the doctors to do it.
Right.
So
Right.
we're gonna see big delays down the road in getting to our health care. The restraints they're putting on the doctors and hospitals for what they're going to reimburse them for certain procedures and so on. You're going to see doctors who refuse to take certain things, like they may not accept Obamacare, just like some doctors don't accept Medicaid patients. So there's going to be problems, and my hope is that we did need some reform. We definitely needed to find a way to cover people that had pre-existing conditions. We needed to have a way to get everybody into the pool, so to speak, to equalize the cost. But there's an awful lot of things that really worry me. The shortage of doctors and healthcare providers. That's going to be a problem.
There was this article in the paper the other day. It was a plain dealer that whether or not this happens or not, I don't know. But they indicated that maybe in a couple years this whole thing could go down south and not be in effect anymore. That would make it a mess for you guys.
Well, and it's very tough to overturn a law.
Yeah, right.
My hope is that they can tweak it, make improvements to it, and again, I think the comment made by Nancy Pelosi was very prophetic. Well, we got to pass the law first before we know what's in it, and that's kind of the way things are operating right now.
Yep.
And we'll have to let this play out to see how it's going to ultimately affect everybody. I just can't see. They haven't had the sign-ups that they thought they were going to, but if they were to get the sign-ups that they were hoping, you cannot throw that many people into the healthcare system without having more doctors, more hospitals, more availability. And some of the craziness I mentioned earlier that all policies must meet these essential health benefits, one of which is you have to have maternity coverage. So if you're a 64-year-old female or a 20-year-old male, you have to have maternity coverage in your policy.
You're kidding.
To comply with Obamacare.
Even for a 64-year-old?
Yes.
Oh my.
So, that's part of the package, and it has to be in the package. So there's some little quirks in the provisions like that I don't know what they were thinking when they came up with that provision, but there's just a lot of little quirks that need to be tweaked and fixed.
For the person out there that might have questions regarding this, Chuck, or if they have concerns, they probably should get a hold of you, right, or your office.
They can call, or I can give you the website. I'm sorry, I meant to write it down and I forgot, but if they want to go to www.Hanson, that's Hanson, HEMA, HEMA, help.com. HEMA stands for Health Exchange Marketplace, which is the generic term for this marketplace that people can go to buy this coverage. So it's HansonHemaHelp.com.
Okay.
And they can access a special website dedicated just to Obamacare. There are links there to get quotes. You can even go in and see if you qualify for subsidies. And you can actually go on and apply for a policy, although it's probably better that they work in conjunction with me because I can act as an advocate for them if there's any glitches or problems. If they just go directly to the federal website, it may go through, it may not go through.
Right. Are you getting a lot of requests from people to pick up their insurance now that they can?
I'm getting some, but I wouldn't classify it as a lot.
Really?
As I said, because we have such a high percentage of senior citizens here, so we're not getting as many of the under 65 population.
Now, correct me, let me understand this, Chuck. the people out there that are now eligible to get insurance, they still will have to pay for it, right?
Mhm.
So what if they don't have the income to pay for it, or do they will they be penalized if they can't get it, or?
Well, let me back up. Yes, there. Depending on what subsidies you qualify for, and depending on whether you are eligible for Medicaid, which has been expanded, there are some people who may have zero cost if they're extremely low income. And just like anything else, though, there's going to be some people who will get subsidies, maybe $100 a month, $200 a month, to go towards the cost of the policy. And then there's going to be some people who won't get any help at all. They'll have to pay the full premium, and they'll have to decide, you know, can I afford to do this or not?
For the guy woman or man that can't pay, how do you get paid then? That's what I don't understand.
Well, I don't, you know, that's not a big deal for me or concern for me, but basically they would go online, and that would be someone who would qualify for Medicaid.
Okay.
Which is a federal program managed through the states to, basically it's like a form of medical welfare. And so they could get coverage for no cost.
Okay.
Whatsoever.
Okay, gotcha.
And those that are eligible for coverage and don't seek coverage, yes, there are penalties provisions in place. And I think when I was here one time before, I might have misspoke. I said that the penalty was $95. The first year penalty, if you don't enroll this year, and you have till March 30th or 31st, I forget how many days are
I know, I can't remember either.
But if you don't enroll by then, you can be penalized, and the penalty is 1% of your adjusted gross income, or $95, whichever is more. So for anyone making more than $10,000, it's going to be more than a $95 penalty.
Wow.
And that penalty will go up each year, I think until 2016 at least. So they're going to have some, you know, some pretty stiff penalties for people that don't buy insurance.
I'm not going to mention his name, but one of our callers here has said that he does not have the insurance and he's not going to get it. And I told him, you might get penalized then.
Yeah,
or
he
will get penalized.
Yeah, he will. They do it. Again, we don't know all the provisions yet because they're working them out, but it's basically going to be when you file your income taxes. If you don't have a valid health insurance policy, then you will pay a penalty, or if you have money coming back, they will deduct the penalty from the money you have coming back.
Kidding.
Yeah.
Whoa.
So.
Wow. A lot of different situations here that I guess I wasn't aware of until today, you know, that and the 64-year-old lady that needs maternity, that just kills me. I think that's unbelievable. Hi, you're on the air.
Well, see, now, he just said if you file income tax. And what happens if you don't file income tax? How are they going to penalize you?
Well, that's when they send the guy out with the uniform and the badge to pick you up and put you in jail, Dennis.
Is that what they do when they bought all them? They hired 10,000 IRS agents and all them shotguns and, what, six Olympic-sized swimming pools full of shells? Is that what they're going to take with them?
Yes, yep, that's right. And I heard
I'll be waiting for them. I mean, because we're, you know, like John, our Supreme Court Justice Roberts said, it's our problem because we elected these people, right?
That's exactly right.
Yeah. Well, we know who these people are. So if anything happens, you know, this ain't a threat, but if they want to start a civil war in America, they're working on it. I would say.
Well,
because you know how many people don't file income tax in Nashville County.
Yeah, we can read in the paper almost every week the people that have been fined for not filing county and city tax forms. So
yeah,
I'm sure that's true of the income tax. And Dennis, you're always going to have people who don't agree with laws and choose not to obey those laws. But when you stop and think about it, a lot of the laws that are passed are for the public good, and like I mentioned earlier, some people will be helped, some people will be hurt, but you know, it's just like speeding. you just can't get in your car and go 100 miles an hour down Route 7. And you may disagree with that, but if I'm the Amish farmer coming down in my buggy, I certainly would agree with that. So somewhere along the line, you have to balance.
Yeah, but we have a choice if we want to go 100 miles an hour, right?
Well, that's true. Yeah, you do.
We have a choice. And now, you said the Amish. Is the Amish exempt? I keep hearing that from the healthcare.
I'm not sure on that, Dennis. Because,
I don't know about that.
I don't either, but you
Because
could,
they don't file income tax.
well,
They
I
pay
don't,
property tax, but they don't file income tax.
you could be right. I don't know. I'm not a tax expert, and I'm not an.
Yeah, I've been hearing,
No,
little
okay.
things about that. I just didn't know if it was true or not.
I don't either. I would think.
I know a lot of certain little groups are getting exempt, but I didn't know if the Amish was one of them. I would say they would be.
Well, they probably should be.
From what I understand, I'm going to be exempt anyway because I'm poverty.
Some of the groups that are exempt are rather questionable. There's certain
Yeah.
parts of government that have been exempted, certain unions, certain very, very large employers, and if you're going to make the system work, everybody has to have some skin in the game. Everybody.
Yeah.
Right.
That's the only way to make something work like that.
Yeah. All right.
All right,
Okay,
thanks,
Dennis.
Dennis.
Thank you.
Okay. Okay. Any questions? You can call Chuck's office, Anchor Insurance here, or go to the website Hanson,
HEMAhelp.com.
HEMAhelp.com, and you can get your answers there as well. I wanted to get into some other stuff here, Chuck. We mentioned the pipes breaking and stuff. Does insurance cover that?
Yes, it does.
It does. Have you had any claims on that yet?
We've had one, and I thought we would have more, but knock on wood, we've only had one. It's funny you mentioned that because I was thinking the other day, I moved to Conneaut in the 60s, and I don't remember if it was the late 60s or early 70s. I remember reading in the local newspaper, which you probably were writing for at that time,
Go on.
that the fire department was going out and thawing pipes in people's houses. And
Yes,
they were
sir. Yeah.
going down the basement and hooking up whatever they did to thaw the pipes out, and and that's the last I remember of something like that happening in Conneaut. But we had some bitter cold weather that hung on for like weeks.
Yeah.
And
Yeah.
that's when we had the problem. So
I remember I didn't start the News Herald to the late 60s, 68, I believe it was, 68, 69. But I remember working in Allied Resonance as a kid just out of high school in 67, and that winter we had a terrible
is that right? Freeze.
freeze like this. And I remember, we worked in presses, and it was just good to be at work by these hot presses, And I do remember during one of these freezes, one of the banks uptown was robbed. And I can't remember if it would be the old Society Bank.
Jeez, I don't remember
Which
that.
one do you work at? Northeast? Was it?
Farmers.
Yeah. Farmers.
Which ended up being Society, which ended up being Key Bank, and
Yeah, is that where you started out? Was Farmers?
yeah.
Was it really? You ended up over in West Springfield.
Yes, I did. Yeah, I went over there and worked for the, I call the Albion Bank. That's not technically their name, but at their West Springfield office.
Yeah. I remember. And then after that, you got into insurance.
Yeah.
Yeah.
But you're right. There were some bitter winters back then. It seems like it's like you think of when you were a kid. It used to snow in November, and it would be on the ground till April, and it would be black as coal because of the coal dust being burnt.
Right. Yeah. Yeah. They're saying we haven't had this cold of winter for 20 years. To be honest with you, I can't remember back 20 years what it was like in 19 or.
Well, who's to say it was 19 or 21 years or 20?
Right.
Somebody throws that out there.
I just can't. Let's see. That would be 1992, 20 years, or 94. I just don't remember. All I can remember is this, and I don't like it. And like you say, when you have a long winter, which we're going to have now because we had snow in November and December, you got another good 2 months of this to go at least.
Somebody told me that Dick Goddard said that we were going to have snow and bitter cold up until about the middle of January, and then it was going to be a more mild winter after that. I hope they're right. I don't know, but
Well, he takes that a lot from those woolly bear things, and that's what one of the guys here at work said. That's what the woolly bears are showing.
Oh, is that right?
A hard beginning of winter, a middle, calming down, and then a hard end.
good.
So maybe
Really?
maybe if we can get to the middle ground, I can accept that.
There you go.
Yeah, yeah. What else is going on? Anything?
Nothing much at all. Things are kind of quiet on the Western Front, so
Good.
to speak, and had good holidays. How about you?
Very good holidays.
we
Yeah,
did
it's
too.
fun. Of course, you got the little ones now,
Yeah.
and that little Maria, she calls me every now and
Oh,
then.
I know. No, I have to tell you something. She's in Girl Scouts, and she was at our house yesterday because the kids didn't have school, and she says, "Grandpa, could you ask Mr. Williams if I can come on the show and sell Girl Scout cookies?"
Let her come on. She'd be a great guest co-hostess.
I said, "Well, if they let you come on, they got to let every other Girl Scout come on." I don't know how that would work out. I don't know. You know.
I'd love to have her on though, because she's a doll. She's got the personality.
Yeah, maybe next time she's available, I'll bring her.
Yeah, do that.
Yeah.
Do that when she gets some time
Okay.
off from school. What are your hours and days, Chuck?
9 to 5, Monday through Friday. Evenings by appointment. 9:30 to 12:30 on Saturdays. So
Yeah, very good, very good.
yeah.
You got to tell Alice. I was thinking about this on the way in today because I knew you were coming in. I have not had her spaghetti since we moved into that house, but she's a fantastic spaghetti maker there. So tell her if she has an extra bowl sometime, I'd like to have one.
Did you get that hint, Alice?
It wasn't even a hint. It was pretty well going.
Start making the meatballs.
right. Chuck, always a pleasure having you
Thank
in.
you, Pat.
You taught me a lot more today than I really knew about Obamacare, and kind of shocked me in some things too. Come back and see us more
We will,
frequently.
and I'll keep you posted because, as I said, it's evolving and changing, and
And we'll be.
yeah, and as an insurance agent, I like to be able to advise my customers, well, this is what I think you need to do, and you should be good going forward. But it's like a client I had the other day, and we worked out some details on a health policy, and he says, well, now do you think it's going to be the same next year? And I said, I have no idea.
You don't know.
Yeah, and it's very hard to counsel someone when you don't know what the future is going to hold, and
Sure.
it's never been this much in flux over the years on healthcare. So,
Yeah, it's got to be a major change for you. And your
and for the
industry.
doctors and hospitals, I'm sure
Mhm.
Dr. Brian and your guest will tell you that
Yeah.
they don't really know where it's going to either. So,
Yeah, just got to shake your head.
so it'll be interesting.
Yeah,
Give us
very
something
much
to talk
so.
about.
Yeah, come back and see us next month if you would.
Definitely would.